right, well, it is 6 o'clock, so I'm going to get started. Um, well, welcome to our webinar, and thank you for joining us. My name is Laura Dagley, and through my work as a nurse and on environmental health issues with Physicians for Social Responsibility, Pennsylvania, I've noticed that there has been a breakdown of communication between physicians and patients, just in general, but also especially when it comes to environmental health issues. And now this is a multifaceted issue that spans across healthcare and includes more than just environmental health. So it can't be covered completely today or solved completely today, but I'm hoping that we can open up this conversation uh, by helping patients understand the backgrounds that physicians are given on environmental exposures so they can understand where physicians' responses are coming from, and then by helping physicians or other healthcare providers understand the patient experience when they come to them with these concerns. And I think it's important to remember that in the end, we all want the best health outcomes, and that starts with improving communication and education around these issues. We have with us today Dr. Ned Katayer, who is a Pittsburgh area pediatrician and the board president for Physicians for Social Responsibility, Pennsylvania. We also have Dr. Pune Sabiri, who is an occupational and environmental medicine doctor and a past PSRPA board president. And after hearing from them about environmental exposures and environmental medicine, we're going to hear from stories from people who experienced environmental health impacts and who reached out to their physicians. And so first we will hear from Hillary Flint, who is the Director of Communications and Community Engagement for Beaver County Marcellus Awareness Community, and was also someone who was affected by the East Palestine train derailment and chemical disaster. We will then hear from Diana Steck, who is a nurse and has been an environmental justice advocate for over 40 years, and who her and her family experienced health symptoms from living near a hazardous waste site in Yukon. If you have any questions during the presentation, please put them in the Q&A and we will get to them when everyone is finished. So I will hand it over to Dr. Katayer to start.
Thank you very much, Laura. I appreciate that. Let me get this started without losing a finger and we'll be good to go. Okay, can you see my slides?
Yep.
All right, well, thank you. Thanks everybody for joining us tonight. Much appreciated. So medical schools barely scratch the surface when teaching future physicians about environmental health. Even though the environment is everything around us, and the threats to our health are everywhere, in the air we breathe, in the water we drink, in the soil that we grow our food in. And as a result, health providers are often limited in assessing risk from environmental sources and giving advice to patients to help mitigate environmental health risks. There are many environmental factors that impact health. Our work at PSRPA focuses on health threats related to fossil fuels and how they adversely impact air quality and water quality and the safety of our food supply, while also accelerating climate change. Tens of thousands of synthetic chemicals, most of them derived from fossil fuels, have become ubiquitous in our consumer products, in the environment, and ultimately inside us. PFAS chemicals, for example, those per and polyfluoroalkyl substances or forever chemicals, are used in manufacturing and oil and gas fracking, and in the products we enjoy. Practically everyone who is tested for PFAS has detectable levels in their bodies. These chemicals have a disturbing habit of disrupting our endocrine systems in extremely small concentrations. Plastics poses another public health hazard as they break down and degrade in the environment. We end up breathing and ingesting microplastics, which have recently been detected in practically every organ that researchers have looked at, including the human placenta which indicates that babies today are being born pre-polluted. Finally, we've been watching the health threats from climate change multiply in the US and around the world, from excessive heat, extreme precipitation and flooding, damaging storms, droughts, and most recently in Los Angeles, devastating wildfires that expose the public to toxic air pollution. Now, one well-developed skill that health providers learn is taking a thorough medical history. In fact, it's the medical history and the physical examination that more often than not leads to a correct diagnosis. Imaging studies and blood work and other tests, they often just confirm suspicious uh, findings uncovered by a good history and physical. Social and environmental determinants of health are key components to a good history, helping providers identify individuals and communities that are at risk for poor health outcomes. From the 21st century, or in the 21st century, we're constantly exposed to physical risks and chemical and biological hazards at home, at work, and in schools, from contaminated air, water, and food, and from humans and other life forms that serve as vectors of communicable diseases. For many, the presence of food insecurity and a lack of clean water adds to the environmental health burden. Maybe the most important health determinant of all is your zip code. You might be surprised to learn that most providers might only have a general idea about where you live and what's around you. Now, I live in Washington County, which is the most heavily fracked county in Pennsylvania. And recently, I wanted to get an idea of the extent of shale gas development or fracking in my neighborhood. I was particularly concerned about kids who attended the Canon McMillan School District, where a spike in Ewing sarcoma has been observed. I opened up a map app on my laptop and carefully marked every fracking well and compressor station and other infrastructure that I could see. I didn't mark the thousands of older conventional gas wells in the county, many of which are unplugged and leaking, and they might be making people sick. They probably are. But you can see on this map just how extensively fracking sites have been built up in the county over the last 20 years. And you can see how close it all is to those yellow thumbtacks. Those are the Canon McMillan schools. Seeing it from space, from the satellite data that Google collects, it's astonishing. If I ever develop symptoms that I think might be related to fracking, I'm definitely going to show this map to my doctor. All of us are vulnerable to health damage from environmental health threats, but some of us are even more vulnerable to the effects of pollution and petrochemicals and climate change. It shouldn't surprise anyone that women and children are at the top of this list. Pregnancy is an especially sensitive time for pregnant women and their babies. Children are more vulnerable to pollution because their behaviors and interactions with the environment increase their risk of exposure. Children eat more food and drink more water and breathe more air per unit body weight than adults do. They spend more time playing outdoors and they play in the grass and the dirt, which is close to the ground where pollution settles. And every parent will tell you that they put everything in their mouths: dirt, rocks, toys, dirty hands and fingers, food. Their rapidly growing and developing bodies are susceptible to damage from toxics, especially their brains and their immune systems. And also, children have a long shelf life, which means that signs and symptoms of some diseases may not be felt for years or even decades after exposure to toxic chemicals and pollution. And we mustn't forget that the most important predictor of poor health in adults is poor health in childhood. By the same token, good health in children improves their chances of a healthy future. Elderly people and those who live with chronic medical conditions and disabilities are at risk, and people living in low income and minority communities are more likely to be exposed to higher levels of fossil fuel pollution and have more health problems related to those exposures. People of color and indigenous Americans who often live in environmental justice zones close to polluting industries, they're also at higher risk of exposure and health impacts. Industry workers who are exposed to physical injury, air pollution, chemicals, and radiation may not have the personal protective equipment and training necessary to protect themselves and their families from harm. Workers who labor outdoors are at risk from rising heat and extreme weather from climate change. And we shouldn't forget about our first responders who will bravely run into dangerous situations without full knowledge of the threats they are about to encounter. The long-term health impacts from fossil fuel pollution and our never-ending exposure to plastics and petrochemicals are pretty well known after decades of occupational and community-based research showing impacts from pregnancy to childhood and into adulthood, from the cradle to a premature grave. We know that tiny particles, toxic vapors, and synthetic petrochemicals that we are regularly exposed to can impair fertility, complicate pregnancies, and lead to poor birth outcomes. Birth defects and developmental delays lead to lifelong health burdens for young children, for their families, and for society. Lung cancer, bladder cancers, and other types of adult and childhood cancers are linked to fossil fuel pollution, which impacts practically every organ in the body, not just the lungs, but also the heart and the brain and the liver and the kidneys. Recent research describes the links between fossil fuel and petrochemical pollution and the development of obesity, type 2 diabetes, dementia, anxiety, depression, and other forms of mental illness. And it's now estimated that nearly 9 million people worldwide die prematurely each year as a result of exposure to pollution. And that includes tens of thousands of Americans. Over the last 35 years, as plastics made its way into our lives and accumulated in the environment, there's been a corresponding rise in chronic diseases in the US and globally, in neurologic disorders like autism and dementia, cardiovascular diseases, environmentally sensitive cancers, especially in young adults, digestive disorders, obesity, and type 2 diabetes. Lower sperm counts in males and other reproductive impacts have also been documented during this time period. And it's probably not coincidental that the rise in chronic diseases in the US correlates with the fracking boom and the expansion of petrochemical and plastics manufacturing. Since 1990, that's the year that I started private practice in pediatrics, humanity has burned through more than half of all the fossil fuels ever extracted. More than 75% of all the plastic on this planet is also less than 35 years old. And you can see the forecast for future plastic production keeps rising, making this a dangerous time to be a kid. So, how should people address their health concerns with providers? First, keeping a health diary can be helpful. List any symptoms that you're concerned about, note whether the symptoms correlate with the weather, and note any changes in the environment around you, like smelling and unusual odors around your house, or any changes to the color, smell, or taste of your water. Let your provider know if you live near an industrial site or a heavily traveled road. Make sure you come prepared for your visit. Bring questions. Remember, time is limited. So keep your questions brief and make sure you take notes of the answers. Be patient with your providers. They may not be able to answer some of your concerns related to environmental triggers, but there are resources that they can use to guide them. The Pennsylvania Department of Health has been slow to recognize the need to educate health professionals throughout the Commonwealth on environmental health risks, but things are improving. The department wants to be a resource for providers who have concerns or questions about their patients' health and whether environmental exposures may be a factor. Their website is much more useful than it used to be. In response to environmental justice concerns, DOH created the Environmental Health Indicators Map, showing where manufacturing, extraction, waste, transportation, and other polluting infrastructure are located, and who lives in those areas, and how healthy those residents are. This can help providers learn more about what's going on in their patients' zip codes. Just last week, the Department of Health issued a Health Alert Network, or HAN, advisory with resources to help healthcare professionals assess the health effects of environmental exposures and respond to patient concerns. Every health professional in Pennsylvania should make sure they receive these advisories, which are issued periodically, now usually several every month, that provide guidance on a variety of relevant clinical topics. It's important for providers to listen to their patients if they feel their health is being damaged by local industrial activities or other threats around them. They should feel free to contact the DOH and speak with a staff member directly about any questions or concerns they have about their patient's care. Providers are encouraged to submit complaints on behalf of their patients if they feel their health is being affected by fracking. And patients can submit their own complaints as well. I do recommend emailing DOH and also calling them and leaving a voicemail to ensure they receive the complaint. You should expect a response within a day or two. And if you don't get one, resend your email and call again. And of course, anyone having serious health symptoms should seek medical care immediately. Of course, if anyone has any questions or you need guidance on where to turn for information, especially as it relates to fracking, plastics, or climate change, I'm easy to reach at ned@psr.org. So I thank you for listening, and I'm going to turn this over back to Laura.
Thank you, Ned. I'm now going to pass it on to Dr. Sabiri for her presentation.
Thank you so much. Let me see. I'm going to share my screen now. Can you see my screen?
Yes.
All right, fantastic. Okay, great. I really appreciated being invited to contribute to this panel because it brought up a fundamental question for me, and it offered me an opportunity to do a deep dive into really how did this specialty come about? At what point did we recognize environment, as Dr. Kataia pointed out, as a determinant of health? And how did it really come to be in the state that we are today, which is, a medical specialty? So I know that and having done work in Pennsylvania for, the last 12 to 13 years, many of the residents who work and live, in the Northeast Pennsylvania, Southwest Pennsylvania, they take a lot of medical concerns to their, clinical providers. And they're not very satisfied with the results of that visit. And so what I wanted to ask is there anybody on the, on the webinar who has taken an environmental concern, an environmentally related health concern to their clinical provider, and that provider has been able to assess that medical concern and known what questions to ask? Whether they have known, whether you've taken, a water test from your, let's say, water well, and they've known how to interpret that test. Maybe even some air sampling and air testing. Do they know which labs to order? Do they know how to treat the problem once it's been evaluated? To manage or maybe make recommendations for the, the environmentally related medical concern? Do they know who to refer to, what specialists, what question to ask of that consultant? Do they have a network of these specialists, that they can tap into? Now, it'd be great if there are, if people have had the experience where, all of these questions have been answered for them. However, historically and in my personal experience, the answer to many of these things has been no. And so then the question comes up, well, why? To do that, we have to go into a little bit of history. Here, I am showing, I did 2 engrams, and what I'm trying to show here is a comparison between a medical term that we're very familiar with, surgery, which is down here, and this medical terminology that we're talking about right now, which is environmental medicine. And here you can see that surgery appeared in medical literature, and in literature, we're going back as far as 1800s down here. However, when you map out the terminologies related to the topic that we're talking about today, so like, for example, environmental health, That started in the 1940s. And then environmental medicine, it started in the like 1960s. You can see that, you know, over here, this little blip, and then it increases a little bit more in the 1990s. We also have related topics like occupational medicine and occupational health, which again precede environmental medicine by having started in the 1940s. There was a term called industrial medicine, which is the precursor to occupational medicine. And as you can see, that started a lot earlier, the early 1900s, but then it fell out of favor. So you can see that, you know, there are these concepts that have, you know, long history in medical sciences like surgery. But then in comparison to those things, these are extremely new topics. These things that we talk about, like environmental medicine, environmental health, they're very new topics. They haven't really been around, you know, in this you know, clinical vocabulary. So, and then when a couple of years ago, I did a talk, and then, you know, and I explained what my specialty is, occupational environmental medicine, and somebody came to me and said, you know, I'm really glad you explained that. And here's a kind of a question to the audience. When you hear the term environmental health, do you think that it means the environmental factors that determine health, or do you think that it means the health of the environment? And I can't see the chat. So if you guys are answering, I appreciate it. If you're not, it's okay, because there is the general population, when the terminology environmental health is used, they often think health of the environment. So for example, in this talk that I had done a couple of years ago, when the person thanked me for, you know, to explain, you know, like what my specialty was and what environmental health meant, she said that when, you know, she hears the word environmental health, she thinks like I'm, or whoever's talking is talking about the trees, for example, the health of the trees. And so it's really important to recognize that kind of the words that we use may not be interpreted the same way, you know, by the audience. And then, of course, there is kind of like, you know, people who say they have, the practice of environmental medicine, and is that the same as a specialty called occupational and environmental medicine? And besides, like, what does environmental medicine or environmental health have anything to do with occupational medicine or occupational health? So let's explore the answer to some of these things. In the early 20th century, the industrial medicine, or industrial toxicology also is what it was called, was recognized. And a lot of that was really as a result of, you know, people who kind of like, who put this on the map. Alice Hamilton, for example, is someone who really would go and visit people in their workplaces. And then in 1948, the American Board of Preventive Medicine and Public Health was formed in response to the rising awareness of public health. In 1955, a certification in occupational medicine was authorized, so you could be specialized in occupational medicine. However, even though many residencies, you know, and the American College of Occupational and Environmental Medicine had added the word environment to that title, that the word environment was not added to this specialty called occupational and environmental medicine until 2 years ago. It only happened in 2022. And then on top of that, and Laura, you know, you can correct me if I'm wrong, but the American Association of Occupational Health Nurses exists, AOHN. However, I haven't been able to find an educational curriculum for environmental medicine in nursing, or environmental health in nursing. So what contributed to the formation of the specialty occupational and environmental medicine? Now, first of all, as I said, there was a rise of awareness about diseases in workers and working conditions, right? I mean, if you've read The Jungle, right, it came around with industrialization. So, for example, ILO, or Industrial Labor Organization, was formed in relation to that. And as you heard Dr. Katayer say, he named workers as populations that could be vulnerable to environmental factors. So it made sense, that workers would be, a category where environmental determinants of health would be most obvious. And then there were these like high profile air pollution event, like, the neck of the woods that, many of you in the call are from, Donora, Pennsylvania, where there was, so many health effects that were related to it. And it was so bad, that it couldn't be ignored. We also have publications like Rachel Carson's Silent Spring that connected what exists in the environment to what can harm the human health. Then we have events that really put environmental justice on the map, like the Love Canal. At the same time, in the 1970s, there was formation of these governmental agencies and these enactment of environmental regulations that really kind of like codified, how to treat environmental pollution from a regulatory perspective. So those were like kind of these like what set up the the environment that led up to this. But then like formally there were two pathways. One was the one that I just explained, which was the specialty of occupational and environmental medicine under the American Board of Preventive Medicine, excuse me. The other one was a formation of a different association. It's the American Academy of Environmental Medicine, or Environmental Association of Environmental Medicine. That was founded in 1965. And it was a group of allergists who came together and they created this association. And they did it because they wanted to expand the understanding of allergy or sensitivity to factors in our environment. Their focus was mainly food, but also it could include like indoor air, like for example, mold. However, this one is not a medically board certification. A medically board certification does not exist with it. There's also no nursing curriculum counterpart that exists with it. And so there's kind of these two parallel things. And this one is the practice of environmental medicine, whereas the other one is a specialty of occupational environmental medicine. And I'm highlighting this just to kind of explain what are some of the factors that can also contribute to confusion about this. So to go back to kind of the original reason for why we even wanted to have this webinar about whether clinical providers know how to do all those things that we said, the issue is that right now, less than 30 residency programs in the United States are training physicians, at least, in this particular specialty who could do all of these, bullet points that we just mentioned. And they are declining by the minute because of lack of funding in this type of training and education. There's also, attempts to establish a nursing educational curriculum, but as of now, it has not been, formalized yet. So in summary, kind of what does all this mean? What it means is that occupational environmental medicine, especially the environmental medicine part, which is our focus today, is new and evolving. Our knowledge of what's happening in the environment, grows by the minute. When the wildfires happen, there's a lot of information, that comes about that tells us, how, like, let's say wildfires, the air pollution from them is even worse than traffic air pollution. There's, again, I said, confusing and unclear terminologies. The group of health practitioners that practices is very small. There's a large body of information to sort out, and there's like thousands of exposures. So this is why we think that patients play a really important role in educating, their clinical medical providers. The barriers, however, that exist is that the assessments can be very lengthy. To get an entire life cycle exposure history, like it could be a very lengthy process. often insurances don't cover them. And then the testing that might be available is not as established by evidence base as kind of the other regular testing, like let's say you test your sugar, you be tested for anemia. It's not as established as those things. And then the regulatory agencies, as I said, they were in the 1970s, and really there has been very little in advancing kind of, what they need to enforce about the environment. And so we're kind of like working on 50-year-old paradigms. And at times that is not helpful at all. And then lastly, many of the products that can cause problems, there's a large financial, incentive behind them. They're supported by these kind of large financial complexes. And so those are barriers to providing information because they get politicized, and then, clinical providers might feel threatened by these kind of organizations, companies that are much bigger than them. So I'm going to stop here and stop sharing and then turn it over to Laura.
Thank you, Pune. That was, I think, really helpful, seeing the background of environmental medicine. So we're going to hear now from people who've had environmental health exposures and who have gone to their physicians about that. So we'll start with Hillary Flint.
Hey everyone. My name is Hillary Flint, and I'm honored to share my story with you today. My life has been profoundly shaped by the intersection of environmental harm and personal health challenges. And I hope my experience sheds a light on just how deeply the environment can impact our bodies and the need for systematic change. So, in my late 20s, I was diagnosed with renal cell carcinoma. It's a type of kidney cancer, and it was a terrifying diagnosis. And it wasn't until later I found out that it was likely linked to PFAS exposure. So, those forever chemicals that Dr. Ned was talking about. I carry a variation of CHEK2 genetic mutation, which means that I get cancerous and non-cancerous tumors. And I've had to be very vigilant about my health. But environmental exposures kind of added that layer of risk and uncertainty that has been hard to control. So I grew up in Beaver County, Pennsylvania, where industrial pollution from fracking, petrochemicals, plastic production, and formerly steel is super prevalent. My environment really compounded my genetic risk. And then in February 2 years ago, a Norfolk Southern train derailed just a few miles from my house. That derailment spilled and then burned toxic chemicals, including vinyl chloride, which released a plume of contamination into the air, water, and soil. And the aftermath was definitely chaotic. But I would say the health impacts that I experienced and the health symptoms are what really made me realize that, this was something that is going to affect people like me more. So not only did it really trigger a worsening of my autoimmune conditions that I have, rheumatoid arthritis and POTS, but I also had a bunch of symptoms that couldn't be explained. And it took me over a year to figure out those symptoms, which were rashes, swelling, nonstop respiratory distress. It was linked to something called mast cell activation. And that's mast cells are a part of your immune system that become hyperactive when they're exposed to things like chemical irritants. And this overreaction leads to a cascade of symptoms. And they're very kind of vague, so it's really hard for a doctor to figure out what your treatment should be. I would say one of the hardest parts about going through the derailment was working with doctors around us and trying to figure out, what tests do we need? What does insurance cover? In my case, I didn't have insurance. So within 1 year, I had over $100K in medical debt. Compounding this is the fact that my county doesn't have a health department. We do not have a county health department, which left residents without a centralized service to figure out what was going on. And our hospital also does not serve families in the way that they need to. We don't have a pediatric department. So as a result of that, my younger siblings, who were also experiencing respiratory issues, were life flighted to Pittsburgh multiple times in the past 2 years. And, environmental exposure is tough, but when you partner that with a lack of infrastructure and knowledge by healthcare providers, it really compounds environmental harm and what that looks like. So for me, I had to educate my own PCP about PFAS and vinyl chloride and mast cell dysfunction, and continuously advocate for my care. It has been a frustrating but necessary process. And I don't think anyone's ever prepared to deal with that type of scale and add in industrial pollution. So, I had already had a heightened risk for health issues, but then you add in a chemical exposure and that risk keeps going up. So I had to push for referrals to specialists, insist on additional testing. I would bring my own research and environmental testing to my PCP. And, it took a while, but my PCP at least started to catch on. And it was really important. I had her note it in my chart, which helped me once we got to the legal part of fighting things around the derailment. But my parents, my siblings, my grandmother, myself, we had lived on my family's land for over 4 generations. And, they can't spend a lot of time there. I am displaced still to this day. We've had to self-fund that relocation in addition to the medical costs. And the sad thing is my source family isn't unique. It's part of a much larger pattern of what industrial pollution and environmental negligence, how it disproportionately affects communities like mine. But despite everything, I have been committed to advocating for change, and I've found strength in my community and telling my story. So I'm happy to answer any questions that people might have later in the program, and I just thank you for the opportunity to tell you more today. Thank you.
Thank you, Hillary. That was a lot to go through. We're going to go to Diana Steck now before we get to all the questions.
Thank you for giving me the opportunity to share my story. And Hillary, you are such a brave young woman, and it hurts my heart to hear that you have experienced much of what my family has been going through for the last many, many years. My problem began in 1978 as a young mother, well, not a young mother, a young wife. My husband and I bought a starter home in the town of Yukon, a quiet little sleepy village in Westmoreland County. And we thought it was just a really good starter home, and we would live there for a little while and move on. A few months, I'd say within 6 months of living there, we started to have frequent infections. I had childhood asthma, which I had outgrown. It came back, and I couldn't understand why all of a sudden. My husband had also developed respiratory issues, this chronic cough. It was like a chronic bronchitis. He also developed rashes that were on his chest and his shoulders. The doctors really didn't have any, explanations as to why this happened. And at the time, we didn't know that we were less than a quarter of a mile away from a hazardous waste facility. So, things continued. We continued to have these problems. And a year after living there, our first child was born. He was a healthy baby, perfect APGAR score. He was beautiful. And we brought him home. And within 2 weeks, this wonderful, happy little baby started to have these chronic infections. He started out with ear infections, urinary tract infections. He even went on to develop hepatitis. And in the meanwhile, we're all dealing with problems. They were checking our urine just as a standard urine test, and we all had blood in our urine. And there was, doctors just couldn't give us answers to a lot of this. Treated us and sent us on our way. 2.5 years after Jeremy, my son, was born, we had our second child, who again was a healthy, wonderful little girl. And shortly after she was in our home, she started to become ill too, with asthma, respiratory problems, blood in her urine as well. Then my son went on to develop a hepatitis for which they couldn't determine a cause. And then I started to develop neurological symptoms. I developed what was called a stocking glove neuropathy. I felt like I had gloves on my hands and heavy socks on my feet. I had decreased sensation. The way I discovered that this was coming on was I was preparing my children's bathwater. And luckily, my husband was helping me to get the tub toys ready. And he put his hand in and said, "Oh my God, you're going to burn the kids." I couldn't feel the water. I had also been having joint pain, numbness, tingling, and weakness. So long story short, we're dealing with all of this. And meanwhile, Jeremy, my oldest child, was being hospitalized for these infections, urinary infections, respiratory infections. And we were all recovering. And there was an article in the daily newspaper in 1985. Now we had lived there from 78 to 85, and we're dealing with all of this stuff that we thought was just bad luck. Doctors were telling me that, the reason that my blood counts were so low, it's just because I was, still working as a nurse at a busy emergency room and running after 2 little kids. So I read this article in the paper that tells me about this leaking hazardous waste dump that is in my town. I knew nothing about it. And it said that the state was temporarily shutting it down because of all of these chemicals that were leaking out and had contaminated the groundwater, the soil, the air. And they were chemicals, there was a whole laundry list of them. They included a plethora of heavy metals, industrial solvents, benzenes, toluene, phenols, a myriad of acids, to name a few of the things. And that was what we knew that was there. We took a ride and we saw this facility, and it was actually oozing green slime out onto the road. There was no fence around the facility. And I looked at it, and it was terrifying just to look at. Not knowing whether that could be what was causing our problems, I decided to go to the hospital library and get out a toxicology book. And I looked up all of those chemicals. And as I'm looking at these chemicals, I'm looking at the health effects, and it was like, oh my Lord, this is everything that's happening to my family. So I immediately wondered if we were the only people who were sick. So I went on a mission, knocking doors, and I talked to 300 homes in my community. And what I found out was appalling. We weren't the only people who were experiencing these problems. It was unbelievable. We have one street in town that every single family had multiple people with cancers, multiple people with infertility problems, miscarriages. I mentioned the cancers, neurological problems. It was just unbelievable. So trying to get medical help for all of this was really a big challenge. And I think, as Dr. Ned referred to early on, there just hasn't been a lot of education around this, and there wasn't a lot known back in the 1980s about exposure. And in our case, the exposure in Yukon, the facility is still operating, by the way, and it's still there. 62 years, generations of people exposed, and ongoing health problems. And there was just such a hard time to get doctors to appreciate what was going on and to try to figure out what was causing it. And I really learned, as Hillary said, to be an advocate for myself. And I did just what she did. Took information with test results from the facility and the surroundings, and even took the toxicology book in and said, look, could this be what's happening? Well, they did do some testing, and we were found to have heavy metals and trichloroethylene in our bodies. But the thing is, that's a snapshot in time and a measurement. And the way the government looks at things is they look at the exposure from a single chemical, and they look at a low exposure risk, and they consider it acceptable. But when you think about when you're exposed to hundreds of chemicals that have been mixed together and who knows what they've combined into, and you're exposed to those for a long period of time, it's hard to say, and it's hard to make the connection as to exactly which chemical is causing your problems. So it was, and it still is, an ongoing issue. We were advised by the pediatrician to move away from there because, in her words, your son is going to die if you stay there. Moving out isn't always an option for families, and most of my neighbors could not afford to move out. We went into nearly financial ruin we walked away from our house. The bank, I went to the bank and begged them to take my home back. Just take it. There's no equity in it, is what they told me. And they said, you still have to pay the mortgage. So 2 mortgages. And then I became even sicker. My red blood cell count, my white cell count, and my platelets all bottomed and were extremely low. The neurological problems got worse. I was diagnosed with myasthenia gravis, but there was no explanation as to why everything was going haywire with my immune system. And at age 30, the doctors at Presbyterian Hospital told my husband, they called him in, and they had a little talk with us and said, you need to get your affairs in order because the state of your wife's immune system is so bad, we don't think she's going to have a long life. So that really convinced us that we had to move out, and we did. I'm happy to say that my children's health improved dramatically within a year of being away from UConn. I, however, continued to use my abandoned house as an office, organizing the community, and was over there every day. So I continued to get exposed. I was no longer able to work as a nurse, but I could do a little bit with helping to organize the community. My family went on to develop more health issues. My son developed a skin cancer, then Hashimoto's, autoimmune thyroiditis, and now as an adult, he has chronic hives, and he also has developed rheumatoid arthritis. My daughter, who was the healthiest of all of us, but she was younger when we got out of there. She didn't live there as long as the rest of us. Her asthma healed up, and we thought that she was doing well until she married and struggled with tremendous fertility issues and had multiple miscarriages, and finally was able to conceive through in vitro fertilization. And I found from many of what I called, our citizens group was called CRY, the children of CRY, many of them have also experienced the same problem. So I went on to develop breast cancer, and my husband developed the same cancer that Hillary had, primary renal cell cancer, and also developed Sjogren's syndrome. So, the exposure, even though we moved away from it, damaged our immune system so badly that I call it the gift that keeps on giving. What I found helpful for me in trying to get help medically for all of us was not to bring up the environmental exposure first. Let the doctors do their thing with trying to figure out what's going on. And then when they're willing to sit and listen to you and talk more after the initial visit, explain that, when we lived in UConn, I gave them test results and things to show them. But when we weren't there any longer, it was in the news enough that they knew about it and would make correlations. I think it's important that we do keep the diary. That was one thing that helped. We were able to connect the dots that many people in town were sick at the same time. And we were able to reach back and see it was related to spills and things at the site. And I think for everyone who's a victim of any type of environmental exposure, really trust your instincts and learn to advocate for yourself. And if a doctor doesn't want to listen to you or take the time to understand what you're going through, keep looking for another doctor who will. And we spoke about the social determinants of health. If you look that up, the definition is, it's conditions in the environment impact our health. And, as both of the doctors spoke to, we are bombarded in our environment, even if we don't live near a hazardous waste facility, with all types of toxic chemicals. And it's difficult for us not to have some kind of exposure. But if you happen to live near a fracking site or an industrial site, I think that the best thing that you can do is, keep that journal, keep track of what's going on around you, but also keep track of your symptoms. Become an advocate, learn to speak for yourself, and learn what kinds of things can happen from those chemicals. And I think one of the most important things is talk to your neighbors, because there's strength in numbers. And by joining together, you have a higher probability of getting something done and getting the regulatory authorities to step in and try to mitigate the situation. I could talk about this issue in Yukon that's still ongoing for hours. My first conversation with Laura, I think we were on the phone for almost an hour and a half. So I apologize if I've talked too long, but it's hard for me to condense 62 years of pollution into a couple of minutes. But I'd be happy to answer any questions. And I'm just really thankful for having the opportunity to participate tonight.
Thank you, Diana. Yeah, and I do want to acknowledge both you and Hillary have a lot of things that happened to you and a lot of health concerns that you could have had the whole hour to yourselves and probably not have covered it all. So thank you for condensing down what you did, and also acknowledge that for both of you, these issues are ongoing, and these environmental exposures, haven't gone away and are still impacting other people. So that but thank you everyone for your presentations and stories. I think each one of you is bringing a wealth of knowledge and expertise to these conversations. So I think, we've covered a lot in these presentations, but I kind of wanted to go back a little bit to talk, this question would be more for Ned and Pune, but we talk about sort of like maybe the lack of education that physicians receive on environmental health exposures. And I was just wondering if either of you had thoughts on where you think that education would be most impactful. Is it putting it into the curriculum for nursing or med students? Is it through continuing education? Is it through coming from like an agency like the Department of Health or somewhere else? If either of you had thoughts on where that might be most well received.
I think it's all of the above.
That's what
I think-
exactly what I was going to say.
Yeah, I think the curriculum needs to cover it. There's a lot more information. It seems like every year there's more information about what's in our environment and how it affects our bodies. I think that also where you train, where you go to medical school, where you train makes a difference. I mean, I grew up in the first cancer alley outside of New York City and New Jersey in the floodplain between Tom's River and the Meadowlands. That was America's first cancer alley. First time I ever heard the word cancer alley was from my dad, who was a radiologist, who saw so many cases of cancer. And I grew up concerned about the environment and about health. And then I, went to medical school in a very dirty city in Manila in the Philippines, which is the dirtiest city I've ever been at. And so you live it, you breathe it, you see it, and you learn. But if you are somewhere else, you may not have that experience that opens up your eyes. So there are just many ways that I think doctors and nurses and other health providers can really learn a lot. But number one is to keep your eyes open.
I think for me, I would really advocate, we have to start educating people immediately on this, right? So as someone who's a community organizer now, I always think about, educating kids first, right? Because as they grow up, they need to have that love of the environment to care about environmental issues. And I think that's the same for this type of thing, right? When people are in med school or nursing school, they're a little bit more green and excited, and they haven't been like really broken down by the world yet. And so in my mind, that's the moment where we have to get them. So I would love to see this in more, curriculums before people are practicing MDs or RNs. I think it's really important to get them from the very beginning.
Hillary, that's a wonderful idea. And I can speak from my own experience. I was an emergency room nurse. So I worked with a lot of the doctors of all the specialties in the hospital, and many were my friends. And they learned from me sharing my information. And they also learned from seeing my friends and neighbors coming in to the emergency room. And it got to the point where many of my colleagues started looking at the zip code to see where the people were from. And they were starting to think, I have to think outside the box on this one because they're from the Yukon area. So it's going to take people like you and me and all of us to keep making more people aware. And I think having sessions like this and getting people like Hillary and myself to talk to these new residents and interns, to make them aware. If they make a personal connection with a person and can see and feel what they've experienced, I think it makes an impact.
I'll just add that there's a couple of things. One is I want to highlight what Peggy Slota put in the chat, where she referenced the book for nursing education, environmental medicine, that in fact, actually nursing education is one of the first ones that really formalized the education. Although I don't think that it's taught routinely in nursing schools. It's one of those things where nurses would have to like pursue that themselves. But one of the, and then one of the great acronyms of asking about all the different components was I Prepare, which was put forth by the, the nursing education field. The thing that I would say about that is that, honestly, at least for medical education and possibly for nursing too, nobody's going to know about it unless it's asked as a board question. Like it's when you really kind of implement it at the institutional level, where you hold people to task to knowing about it, that then they'll go and learn about it. But otherwise, there is no incentive for them necessarily to do that. So this has to become institutionalized. And I will say that with the awareness of of health problems in the context of climate change as kind of the big group, really kind of like the largest environment they can think of, that has been really bubbled up to the surface a lot more as well. So hopefully that formalized education can happen, and in some healthcare systems that's already happening, like for example in the Veteran Health Administration, where because of the military exposures, there's been a lot of education around what's called exposure-informed care. And so hopefully that can get, multiplied in other arenas as well.
Yeah. So yeah, it just sounds like we need a lot more education in general. So it sounds like, from both Diana and Hillary, and there's from other stories I've heard, that the only way for things to be taken seriously is for people to really advocate for patients to really advocate for themselves. And so, so when you advocated for yourself or were educating your PCP, or asking for specific tests, I just was wondering if you could speak more on how that was received. Like any advice on how to do that so your physician listens to you, and then maybe Ned and Pune, if you had thoughts on how you would like to hear that, how that would be most well received on your end in order for there to be follow through with that.
I'll address that. I think that it's important that when you are speaking to the doctor, I would always plan. I actually wrote notes before I went in, and would, try to make sure, be mindful of his time, so that I could keep everything very succinct, very, everything bullet pointed, so that I could get everything out that I wanted to, but I would also take information that I had printed and give him to read. And it helped that initially the PCP that I had was my friend from working in the ER, and he was willing to take the time, and he started doing research on his own to help to figure things out for us. I was fortunate there, but many of the specialists that I was sent to, some would just get very, I can't think of the right descriptive word, not angry, but put off, basically like that you were questioning them. You know, they know best. They're not going to address this. That would have nothing to do with what's going on, kind of thing. And, you know, in those situations, I would give them a couple opportunities and keep trying with giving them information. And if that didn't work and they weren't willing to listen, I just moved on. If you see that somebody's not going to work with you and help you, then you try to find somebody that will. And I actually would interview their office staff or nurse before I went there to find out what their stance was on environmental issues before I would even waste my time.
I love that. I will say for me, you know, it's a digital age, and I don't know if anyone has MyChart or the UPMC Anywhere Care app, but you can communicate with your doctor all the time. It
Mhm.
doesn't mean that they answer, but you can send them things. So anytime that, you know, I had a picture of my symptoms or anytime I found new information, I would just send that straight to my PCP. And sometimes it, you know, I would just get the response of like, okay, I've read this. And then when we were in together in person, she had already seen those things that I had sent. And she could look at them on her own time. But one important thing I want to add is, you know, I had a leg up as a young adult cancer survivor. What happens is a lot of times you're paired with a geneticist. So I already had someone who was kind of an expert on solving puzzles. And that geneticist helped me a lot to figure out what was going on with me and to send me to different places. But I will say UPMC has a toxicologist, which I know is far for people in my community that were affected by the train derailment. But you know, I think going to someone who is a specialist in things like this is super important. And that's close enough, right? It's like an hour from where people in my community live. So I always highly recommend going to that toxicologist. However, I will say, you know, you do have to check with your insurance first. They did not cover that for a lot of people, so it was an out-of-pocket cost, and I would love to see, you know, us to figure how do we solve that problem? You know, how is it if you're exposed to an environmental toxin, particularly, you know, how do we make it so that you get to see a specialist? But yeah, I agree with everything Diana said too. Just continually talk about it with the nurses that you see, talk about it when you go in for tests, because more people need to understand how the environment affects us. And I think if they have an entire staff at an office that's kind of buzzing about it, they're going to have to take a further look.
You're right, Hillary, how technology allows us to stay in contact with our doctors and to send photographs from our phones. I mean, it really is incredible. And Diana, I'm thinking, how great would it have been, 40 years ago, 50 years ago, to have Google Earth where you could actually see what your area looked like from space and show that picture to your doctor. And, it would be pretty easy, I think, to identify perhaps where the problem was coming from. And it's really important for doctors to really learn about their patients' zip codes. That's really important.
No, we didn't even have the internet back then.
I just want to be mindful of time and respectful of it. So I don't want to talk too much, but maybe I'll just quickly say that what I love about what Diana's saying is that what she's done is help with pattern finding, which is what you really need to do. She marked down the times, found patterns in other people. So that is an incredibly helpful thing. I would literally like do exactly, she can write the book on, how to talk to your doctor about it. And so what I will say is also that it's also like when you first go, you've had 62 years of that, experience, they just met you. So just be patient, in terms of kind of, building that story. But I will also say that the treatment and the management of an environmental exposure as life-changing as having this hazardous toxic spill, what's the answer to that, right? Like, is it, well, you have to move? It's so in that sense, I also want to really kind of encourage patients to encourage their providers to help with policies that would prevent that in the first place. That, you know, that toxic spill in the first place. So, to also kind of like, you know, have a bigger view rather than just, you know, treat that, you know, particulars, and definitely address it, you know, but also, you know, have a bigger perspective as well. And just maybe one last thing, the Pennsylvania Department of Health advisory that Ned shared, it has a ton of really good information in terms of education. The one thing that they missed, unfortunately, is a link to AOEC, which is the Association of Occupational and Environmental Clinicians, and that tells you who's the one that's closest to you in your zip code. So AOEC would be the only thing that I would include in that. Otherwise, the rest of it is perfectly helpful, and you know, people might want to look into that.
Yeah, thank you. Well, again, I do want to be mindful of the time for people who have to go. If the panelists have time to look at some of the questions in the Q&A, there's, I think some in there that could be answered via text if you had a minute. But I do think that, you know, there's a common themes here for people living near industry. You know, there's environmental justice communities, there's issues that you said are just bigger that need to be addressed by policy or regulatory agencies. Physicians need more education on environmental exposures, and patients need to be not afraid to advocate for themselves. I feel like those are all kind of common themes that come through. Don't be afraid to speak up. Find a different doctor or PCP if yours isn't listening. But yeah, if any of our panelists have any last comments, you're welcome to. But otherwise, I'll let people who have somewhere to be after 7 go. Thank you.
I did see that there was a question in the chat about cumulative impact, so how multiple different things impact one person. And I think it's important to highlight that there is a public comment opportunity right now with the EPA about considering cumulative impacts. So I will get the link for that and put it in the chat, but I think it would be really helpful if everyone said, yeah, we do need to consider all of these different things when making determinations. So I'll put that public comment link in the chat.
Thank you.
I just want to thank Hillary and Diana for telling their stories. Just, you know, just incredible stories and heartbreaking stories that really bring the issue home. You know, if you don't hear stories like that, you don't quite get it, I think. And they told their stories very well. So thank you, Hillary, and thank you, Diana.
Thank you.
Thank you.